Facebook at YouTube live stream viewers. Naririto po ulit tayo this afternoon sa ating Nutrition and Health Webinar Series. This afternoon, pag-uusapan natin ang isang parte ng ating katawan kung saan nagmumula ang ibang sakit at karamdaman na nanggagaling sa aig o sa mouth. Para sa dagdag na kaalaman at tulong upang makaiwas sa mga sakit tulad ng COVID-19, 19, nagpapatawa lang. Pag-uusapan natin sa episode na ito ang pinamagatang The Importance of Complete Oral Hygiene as a Daily Habit. So this webinar series is a community service brought to you by Pharmacia Jimenez Corporation with our today's sponsors, Aranim Terra Mouthwash, Nimit Clean Isopropyl Alcohol, at Nimit Antimicrobial Soap. I'm Grace. I'm going to be with you for the rest of the hour, your moderator host for this Nutrition and Health webinar. Para samahan tayo at maipaliwanag tungkol sa kahalagahan ng complete oral hygiene sa pag-iwas ng mga sakit na nanggagaling sa bibig, this afternoon we are so privileged and blessed na pinaunlakan po tayo ng isang dalubhasang doktor. He is a fellow of the Philippines Society of Otolaryngology and Neck Surgery. He is a consultant to help serve Los Baños Medical Los Baños in Laguna, and he is also and the medical city in Laguna. And take note, sorry for that, and take note, the doctor is not just a doctor or a surgeon, he's also a triathlete. In fact, he is a multiple Ironman finisher and a member of the UP Los Baños Trentades team at Argon Triathlon team. Sa mga ka-webinar natin this afternoon, let us welcome the very good-looking surgeon, Dr. Anthony Charlie Dalmasio. Good afternoon, Doctor.
Hello, good afternoon.
Say hello to our webinar, to our YouTube and live viewers.
Hello sa mga viewers. Thank you for tuning in for this hour. I hope you'll be informed and you'd like the presentation for today.
Thank you, Dr. Charlie. Of course, we also invited a guest from our consumer side who will also share her actual experience as a patient related to her daily activities or routine. Actually, she is a licensed physical therapist and currently a third-year medical student of Fatima University School of Medicine. Good afternoon, Ms. Jacqueline Reyes. Thank you for joining us this afternoon.
Good afternoon po. Good afternoon to all our viewers.
Yan. Thank you, Jackie. So, sa lahat po ng nanonood ngayon via Facebook Live at YouTube Live, to our lovely viewers, please don't hesitate to post your questions or comments down below. We will try to answer them later if you have topics that you wish to discuss. On our next episode, just comment below and give us thumbs up or heart if you enjoy and you are enlightened with today's episodes. Sa mga Facebook Live at YouTube Live viewers natin na mag-actively participate at magtatanong, you have actually a chance to win a special gift pack from Aranim Terra Mouthwash, Nimit Clean Isopropyl Alcohol, at Nimit Antimicrobial Soap. So if your question or your comment gets to be chosen later, expect great giveaways from our sponsors. All right, let's Dr. Charlie. Pwede po bang paliwanagan niyo kami kung ano po ba yung role ng ating bibig sa pagkakaroon ng sakit at karamdaman? Ano po ba yung importansya or yung importance of complete oral hygiene, just like mouth rinsing as a daily habit para po maiwasan yung mga sakit, lalo na dito tayo ngayon at nakakaranas ng pandemic. Dr. Charlie?
Okay. Screen share muna tayo.
Okay.
Okay. So for today, we will talk about the importance of complete oral hygiene as a daily habit. how can you say that you are completely healthy kung ang iyong bibig naman ay may problema, di ba? So this part of our body is very essential sa well-being natin. And I will be discussing bakit and how to uh, prevent problems starting from the oral cavity and how it impacts our life. Okay? So what is oral hygiene? Oral hygiene is the practice of keeping one's mouth clean, free of disease and other problems by regular brushing of the teeth, dental flossing, and gargling with a mouth rinse. Okay? So why is it important to have complete oral hygiene? Well, as I've said earlier, how can you say that you are healthy overall if if you have poor dentition, you have bad breath, or you have mouth sores, di ba? Or you have an infection sa throat or sa mouth or sa tongue. So dental problems such as cavities or gum disease can impair your ability to eat and speak properly and also cause pain and bad breath. So also as a consequence of this, your self-esteem may also be affected. I've had patients who complain that they feel so low, they feel depressed because they can't speak to other people kasi bad breath daw sila. So this is very important to some people, especially if you're talking to, for example, you talk to other people like you're a sales representative or a customer service, you're a salesperson and you directly talk to people, this could be a problem if you have halitosis or bad breath. Aside from that, you may think that problems of your mouth just stay in your mouth. That's wrong. Uh, there are lots of other illnesses that can start from a poor oral hygiene or poor health of your mouth. Okay? Poor dental health can have a profoundly negative effect on other organs, including your heart, your endocrine system, and also cause pregnancy complications. And eventually, chronic inflammation can cause more devastating impacts on your health, especially your heart. On mouthwashes, there are two main types of mouthwash. One is cosmetic. Mainly, it's just para bumango ka lang. Okay? Kung meron whitening, yun na yun. It's purely cosmetic and doesn't do anything really for diseases. And there are therapeutic mouthwashes. These are, they have antiviral, they have antibacterial, and properties that heal the mouth, well, such as Oranim. This is a good example of a mouthwash that can do that. It's a therapeutic mouthwash. There are therapeutic mouthwash that also control plaque buildup. They also handle gingivitis and bad breath and tooth decay. Uh, Mouthwashes are more important for people who don't regularly brush their teeth or have poor hygiene. This can be this can be more helpful for those people. Okay, you can't remove plaque by. Don't get me wrong. You can't remove plaque by just by gargling or rinsing your mouth. You need to brush your teeth and you need to floss. Okay. Uh, However, children less than 6 of age, they don't really know how to gargle properly. So we do not recommend rinsing for children under 6. However, there are some preparations that come in spray, such as what we have. You can use them for younger age children. Okay? So, ingat sa huwag kayong magpapamumog sa mga batang less than 6 years old kasi malamang malulunok nila yan at hindi naman for consumption ang mouthwashes. Okay? So, these are pictures of some examples of problems in the oral cavity. Well, tooth decay, dental caries, that's one problem. Gingivitis or swelling of the gums or inflammation of the gums. Periodontitis or inflammation around the teeth, and abscesses or pigsa. Yes, you can have pigsa dahil sa poor hygiene. Pag bulok na yung root ng ngipin, pwede siyang tumagos into the oral cavity forming an abscess. Okay? So, what are the other complications of poor hygiene aside from those localized in the mouth? You can get pneumonia because of the spread of the pathogens down your airway. There is no gateway shutting off your lungs from your mouth. You breathe, so it's open most of the time. You can have low birth weight and premature labor. chronic inflammation in the mouth can produce a chemical called prostaglandins that can induce contractions. So it can affect pregnant women that way. Endocarditis, this is one of the more popular uh, side effects or possible complications of poor hygiene. The infection in your mouth can spread to your heart valves and cause endocarditis. And it has been found that you have a 3 times greater risk of a heart attack if you have poor oral hygiene. This is because you will have elevated levels of C-reactive protein. It's a chemical that indicates a stress chemical, and it has been found that when this is increased, you get a higher chance of getting a heart attack. So oral hygiene is essential to everybody, not just you, not just me. Everybody who has a mouth should have good oral hygiene. So as you have seen earlier, other specialties are involved when there are complications from poor oral hygiene. Well, ENTs are one of them. Internists, cardiologists, as you have seen, that you can also have heart problems, or a pulmonologist when you already have a lung problem that originated from your poor oral hygiene. So let us try to, ito yung, well, if you look at your Facebook feeds, puro COVID na lang ang makikita mo. It is very relevant. And I think it is a moral imperative for us as health practitioners and people who want to educate as a community service. We would like to reiterate. Alam ko nakakarindi na yung mga reminders regarding COVID, but I feel that as you can see sa nangyayari sa atin, the community needs this. Okay? So please bear with me. So the global condition regarding this pandemic is not good. There have been about 21 million confirmed cases of COVID-19 and 771,000 deaths. And this is still increasing every day. As of August 21, in the Philippines, we have 64,906 total active cases. So, mataas pa rin. And if you check the new cases every day, mataas pa rin. So what do we need? We need to be informed. The population, the community needs to be informed. Because hindi to titigil hanggat hindi tayo as a community act. Unless hindi tayo educated. Okay? So how is COVID-19 transmitted? And why oral hygiene is relevant in this disease? By now, siguro, you should know that, it is transmitted through by droplet. Okay? So it can land on the mouths, nose, or even the eyes of people who are nearby infected people. Then you inhale them and you get infected. Okay? This happens when you're in close contact with another person that is within 6 feet. That's why we say that you should practice social, but it's more proper to use the term physical distancing. Stay at least 6 feet away from other people, whether symptomatic or not, because even non-symptomatic people, asymptomatic people can be carriers. Okay. So this is a diagram just showing that when you cough, even talking, when you sneeze, droplets just they go into the air. Most fall within that 6 feet distance. Most. However, some studies have shown that it is possible that there may be aerosolization or it can travel farther. That's why wearing of face mask and face shield is advocated strongly. Okay, so you can also get infected by touching contaminated surfaces. When a patient talks or coughs on a surface like me on this laptop, it can get contaminated. And if you touch this laptop, then you touch your nose, you touch your eyes, you scrub your face, you can get infected potentially. Okay. Next slide. Okay. So this is just an animation showing how air enters our body through the mouth, through the nose, and eventually into our lungs. So how can we prevent this? We focus on the gateways. Walang ibang dadaanan ang virus kundi ang iyong ilong, ang iyong bibig, at ang iyong eyes. Yan lang ang daanan. Kahit pa makahawak ka ng contaminated surface, hindi yan makakapasok sa body mo kung hindi dadaan sa iyong airway. Okay? So what can we do? We do physical distancing. As I said, 6 feet. Most droplets will fall down on the ground in 6 feet or less. Okay? So you wear face mask, face shield, wash your hands every time you touch a surface. You wash your hands. Mouth rinsing. I'll explain later why this can help. And of course, strengthen your immune system. Sometimes some people are more susceptible to getting infected because of their immune system. They're weaker. So if you have a strong immune system, more likely na matatalo ng immune system mo yung virus, or kung maging symptomatic ka man, hindi ganun kalala. So you should limit contact time with other people. Personally, as a doctor, I limit my consults to 5 minutes kung po pwede. The more you breathe the air, the more you can get infected, or the more they can get infected from me kung ako ay may infection. Avoid contact with sick people. Keep that 6 feet distance margin away from you. The people away from you, the distance. And even some people have no symptoms. So just because they look fine doesn't mean they are not infected. This is more important for the immunocompromised. Kasi, nga, konting viral load, they can get symptomatic and infected. You wear your mask properly. Maraming nakamask. I'm sure marami kayo nakikita, nakababa, nakalabas ang ilong, nakalabas yung baba, binababa. Pag kinakausap, binababa. You should always cover your nose and mouth, especially when talking. Okay? Wearing a mask is important when physical distancing is difficult. For example, you live in a house. Well, not all are blessed with a big house, di ba? Some live in a dorm with other people. Healthcare workers, minsan nasa dormitory yan, or hindi naman gano'n kalaki bahay ninyo. Mahirap mag-physical distancing pag gano'n. So please wear a mask pag gano'n. Okay? Do not use in children under 2 years old. Hindi yan mag-fit. Ma-agitate lang sila. Actually, papasok rin na virus kasi nga pangit ang fit sa mga bata. And if a patient is, and if a person is, what do you call that, there's other problems that prevent them from wearing a mask, do not insist on having them wear a mask, just isolate them. It is not a substitute for physical distancing. Just because you wear a mask doesn't mean pwede kang lumapit sa ibang tao. Okay? It is not a substitute for that. So this is just a picture on how to wear a mask properly. It should cover your nose, your mouth properly, and your chin. Make sure that there's no leakage at the sides of the mask, and there's a metal wire at the nose part of the mask. Pinch that so that it's sealed. As a reminder again, there's only one way to wear a mask. The white part should be inside. Hindi totoo yung pwedeng baliktarin mo yung mask depende sa use. No. The white part should always be facing you. The blue part facing outside. Okay? So once it's on, do not touch the front part of the mask. Do not wear it under the chin. Do not leave your nose and mouth exposed. And when you're in public, do not remove it. Proper hand washing, you just wash your hands for at least 20 seconds. At least 20 seconds. Okay? Every time every time you touch a surface, wash your hands. If you touch a surface, don't touch your mouth, don't touch your nose, don't touch your eyes. And if it's not feasible, if you can, like you're out in the field, there's no accessible running water, no soap, you sanitize with an alcohol-based rub with at least 60% alcohol. Okay? So, ano naman ang role ng oral rinses? Well, it can play a role in the transmission of COVID-19. Oral rinses have been shown to destroy the lipid envelope of viruses. On that lipid envelope, it's just like a outer skin of the virus. The virus particles needed for infection are located there. So once you destroy that, you inhibit the infectivity of the virus. Okay, and there it has been shown in vitro in the laboratory that it decreases the viral. It can decrease viral load in the mouth. And we should always remember that the mouth is the biggest gateway into the body. It's bigger than your nose. Kung barado ang ilong mo, hihinga ka rin sa bibig. Doon din dadaan ang hangin. And when you eat, you open your mouth. That is, you're opening your gateway when you eat. Okay? So other research on mouth rinsing. This study was done in Batangas, and it has been shown to help pregnant women who have gingivitis, and it helps in their health. It's safe. And another study that has been done shown that it can prevent premature labor brought about by the inflammation of gums. So to summarize what I have said, complete oral hygiene is important for your overall health. You can't be healthy with an unhealthy mouth. It is important for everyone, all the time, not even during pandemic times, every day. Even if there's no pandemic, oral hygiene is important. So please don't think that it is only important just now kasi may COVID tayo. No. It is important lagi. Okay? It complements other practices to avoid transmission, that things we have been looking at: face mask wearing, physical distancing, hand washing. It is a good complement to prevent transmission and infection of COVID. You should brush, floss, and gargle for complete oral care. Doing just one isn't enough. And use a therapeutic mouth rinse with the antibacterial and bactericidal and the virucidal effect. Okay, so this is just a teaser slide. This is me operating on a jaw fracture due to a motorcycle accident. Thank you for your time and attention.
Thank you, Dr. Charlie. So bago ako magtanong sa'yo, Dr. Charlie, I would just like to share a video, a very short. It's just going to take 3 minutes. It was done by Hashem Al-Ghali, who is a Yemeni science communicator. Actually, he's actually also a video producer who is best known for his infographics and videos about scientific breakthroughs. Yung work niya sa science as a communicator gained the attention of science, news sources, and social media users. So I think this is very relevant to show everyone, since it also talks about the importance of mouth rinsing during this time of pandemic. Sige, let's play this 3-minute video. Thank you. Yon. So, Dr. Charlie, yun, shinare ko lang yung video that was posted 3 days ago. In fact, the study was done in Germany just to just to give an update on ano ba talaga yung role ng mouth rinsing on top of what you have shown to us. So, salamat for your contribution na maliwanagan natin na marami pa rin talagang dapat tayong i-consider, hindi lang yung point of entry ng sinasabi ng iba kasi pag nahawakan, without even considering na tama ka, Dr. Charlie, we agree with you that the biggest gateway is actually the mouth. So, Doc Charlie, bago ko tanungin yung ating bisita ngayon, I will just ask her to share a little of what she has experienced in the past at saka yung ngayon na experience niya as a medical student.
Okay.
Yes, Miss Jackie, let us hear from you.
Hello, good afternoon po.
Good afternoon.
Yes. Pansin ko lang po, especially this pandemic, naka-quarantine po, some of the people or yung mga hindi masyadong alam how to prevent the spread of virus. Parang hindi sila naniniwala unless na meron silang kaibigan or kakilala na magkaroon na ng COVID. So, I think na it's important na kahit na hindi natin na-experience is we take one step ahead para hindi ganun kagrabe yung mangyari and to prevent na rin yung pag-rise ng COVID cases sa Philippines. Kasi sino pa yung magtutulungan kung hindi tayo-tayo lang din and tayo-tayo lang din naman yung matatamaan if ever. So, ayun, mahirap din po kasi as a medical student, syempre wala pong klase and they're pushing through the online classes. Mahirap mag-aral and yung mga other professionals na kailangan mag-work and other laborers na kailangan kumita ng pera, hindi makapasok. So, sana matapos na yung pandemic na experience niya.
Pero Jackie, you were actually, si Jackie kasi is also is a licensed physical therapist and she was sharing pag may klase siya, the normal struggles that she encounter pag napupuyat siya, lalo na ang dami niyang inaaral, 'di ba, Doc Charlie? Oo, yung common na na-experience niya yung course, yung dryness of the mouth, tama ba, Jackie?
Yes po. Lalo na po pagka super puyat, pagka gising the next day, minsan parang dry yung mouth or hindi ka makapagsalita ng maayos kasi parang kulang sa inom ng tubig or what, kahit na nakainom ka naman ng marami. And ayun po, minsan din sumasakit yung ulo.
Yeah, Doc Charlie.
Yes, ano yung exactly yung tanong?
Should I question na po ba, Doc?
Yes.
Ano po, sige, regarding na lang po muna with the presentation earlier. You said po kasi that it is not advisable for children under 2 years old to wear mask.
2 years old, yes.
Yes. What can you suggest po na isuot nila instead of mask? Kasi 'di ba hindi rin po advisable to wear yung mga fabric mask, yung mga DIY po ng mga tela kasi 'di ba it harbors bacteria din po. So what can you suggest po? How can they protect themselves?
Well, the first and foremost thing you should do is not expose them at all. Parang ginagawa natin sa mga senior citizen, bawal silang lumabas. Huwag nyo rin ilabas yung bata unless na talagang necessary. Yun lang. Since you can't wear a mask, they can't wear masks effectively. Just don't put them in a situation that they will need it. Yun lang. I think that would be the best thing. Prevention pa rin yan.
It's better than cure, yeah.
Yes. Okay?
Yeah.
Kahit pa GCQ, kahit ECQ, GCQ, whatever CQ yan, just because it's GCQ doesn't mean pwede mo na silang ilabas sa public. Ilayo mo pa rin sila. Hanggat maaari, huwag mo na lang sila ilabas sa bahay. Yun na lang.
Tapos po, regarding po pala, may gusto lang po akong i-clarify kasi most of the people that I have asked, parang medyo contradicting yung sinasabi nila. Is it advisable po ba to do mouthwashing after brushing your teeth to lessen daw yung bacteria inside your mouth? Or mas nasisira lang po um, yung ipin kapag ganun po yung ginawa?
I think that would depend on your mouthwash. Because
Mhm.
talaga naman, you rinse after brushing. Yun naman talagang sequence nun. I have no idea, wala po akong experience na may nagsasabi sa amin, ano ba, sa med school or from my dentist na masama mag-rinse after brushing. But maybe that would depend kung anong klaseng mouthwash ang ginagamit nila. Baka naman very personal experience nila kasi nagsisting yung may alcohol, mataas yung alcohol.
Yeah, that's right.
Yan, nasisting yung mouth nila. Merong iba, madali magkasingaw with harsh chemicals. Baka
Mhm.
yun yung basis nila kaya sinasabi masama. Pero minsan yung toothpaste lang mismo ang problema kaya nagkakaroon ng canker sores or aphthous ulcers.
Mhm.
Ayun.
Doctor, pwede kong dagdagan yon. Kanina
Sure.
you mentioned si Dr. Jackie, si Dr. Charlie actually mentioned a while ago in his presentation the two kinds of mouthwashes. Pwedeng therapeutic at saka pwedeng cosmetic. So I think yung question mo about mouth rinsing, not that you really have to consider ano yung nandun sa mouthwash na ginagamit
Yes.
mo. I agree with Dr. Charlie. Alcohol is something that we should really consider. Na lahat ng pwede niyang gamitan can actually harm. Can actually do harm. So, yung mouth rinses in the presence of alcohol, sa napag-aralan ko personally as a dentist, is really detrimental to the good bacteria nung nandun sa loob ng oral cavity. That's why yung sinasabi ni Dr. Charlie kanina, wala siyang na-encounter. Ako rin personally, I have not encountered na dinidiscourage yung mouth rinsing. In fact, after toothbrushing, ito lately yung mga studies sinasabi. In fact, even the video that we showed earlier on actually said na hindi siya nag-cure pero binabawasan niya yung possibility. Tama po ba, Dr. Charlie?
Yes, that is correct.
Mm. So yun yung pwede kong i-contribute dun sa tanong ni Jackie. Tama ba, Jackie?
Yes po.
So you still have another question, Jackie, for Dr. Charlie? Kasi Dr. Charlie, we will be entertaining questions from our live viewers after magtanong ni Jackie sa'yo.
Okay, I have two questions na lang po for
Sure.
Doc.
Yeah.
In regards po with patients na may sore throat, what curative measures po that can you advise to patient na may sore throat, especially now na may pandemic, since we know that that sore throat is one of the clinical manifestation of having COVID cases. So, ano po yung mga curative measures na pwede nilang gawin? Like home remedies or natural remedies po. Yun. Kasi 'di ba, some of the people don't have access to dental facilities. Tapos some of the facilities pa closed. So ano pong pwede nilang gawin?
Okay. First of all, to manage a sore throat, you must know bakit ba masakit ang lalamunan niya. So if we are considering it is a viral infection, it will go away on its own. Okay?
Viral.
Yeah. Yes, it will go away. The best you can do is manage the symptoms. You can gargle. It helps reduce the pathogen load in your mouth. Okay? So gargling is one thing you can do. It's easy to do. Kahit warm water with salt, it can help. It helps soothe sore throats. Okay? However, if the sore throat has already lasted more than 3-5 days, we can already consider bacterial causes. Since you do not have the benefit of a physical exam, for example, you're doing an online consult, you can only rely on a good history and physical examination. Since nagme-med ka na rin, you know that you will ask for possible other signs and symptoms. For example, lymphadenopathies, fever, yun. COVID, mahirap kasi lagi mag-entertain ng COVID kasi they're asymptomatic people. Di ba? So, ibig sabihin, pwedeng mild lang yung symptom, pwedeng yung mga obvious na talaga. It can range from that. It would be really hard to say na may COVID unless establish natin yung exposure, yung travel, mga ganong klaseng bagay. So, para sa mga tao nag-iisip, ay may sore throat ako, baka COVID ito. Hindi dapat ganun ang pag-iisip. Mas maraming ibang viruses sa paligid aside from COVID, lalo na kung ikaw ay nasa bahay lang, 'di ba? Or yung mga kasama sa bahay hindi naman lumalabas. Dapat maiwasan natin yung thinking na yun. So, to answer your question, to summarize it, ano pwedeng gawin? Observe. If it goes away within 3 to 5 days, malamang viral lang yan. Manage the symptoms, gargle. Yun. Madalas tinatanong, Dok, masama ba yung malamig?
Yes, opo.
Dok, masama ba yung matamis? Well, sa akin, hindi ko pinagbabawal ang malamig. Well, bawal ang ice cream kasi matamis siya. Yung sugar, it is very irritating for some people.
That's right.
Yung the sugar, nakaka-irritate yun dun sa balat, lalo pag hindi pa malakas sa tubig, mamamaga talaga. Kasi sabi nila, ay dahil sa malamig, pero yung kinain nilang malamig was ice cream. At syempre, matamis. Soft drinks, sugar. So hindi ko naman pinagbabawal personally hindi ko pinagbabawal ang cold drinks, cold water. Pinagbabawal ko ang sweets. Okay? So yun, yung mga pwedeng management natin. Yun. Pag 5 days na nga, mukhang bacterial, kailangan ng antibiotic yan.
Okay. Sa nasagot ni Doc Charlene, sagot mo, Miss Jackie, no? Thank you,
Yes,
Dr. Charlene. Dadagdagan ko lang ulit. Kasi natutuwa ako dun sa mga mini-mention ni Dr. Charlie. Sabi niya kanina, kung viral lang yan, you manage the symptoms and then gagaling naman siya. Kasi I understand. Self-limiting ba, Doctor?
Yes,
Pag viral, it's self-limiting. So if you can actually find a mouthwash na merong antiviral na pinag-uusapan na sinasabi ni Dr. Charlie that you can actually manage it after a certain period of time. Tapos, kung kumakain naman ng matamis because of the sugar, sinasabi natin, ang number 1 kalaban ng bibig is actually sugar. Kasi ito yung isang partner para magkaroon ka ng dental caries, para magkaroon ng, tapos may bacteria. So, kung meron ka ring mouthwash na may antibacterial, diba? So, antiviral, antibacterial. Tapos, may isa pang nagkulang doon. Pero kung meron pa rin antifungal na hindi pa natin napag-usapan, wala pang nagtanong, why would you not settle for a mouthwash like that? Plus, meron ka pang, hindi pala meron, alcohol-free pa, na sinabi rin ni Dr. Charlie that could be detrimental to the oral cavity if used so frequently. So, why would you not, use it as a preventive measure para maiwasan natin yung mga sinasabi nating mga sakit na pwedeng manggaling sa bibig and then later on mag-progress, di ba, Dr. Charlie?
Yes.
So ako, nagpapasalamat ako dun sa ating Oranim kasi it has actually antiviral, antibacterial, and anti-fungal effect. So it actually is complete in itself. So Dr. Charlie, thank you, Miss Jackie. Balik kami sa'yo. Meron lang tayo tanong from our live viewers. So, I'm sure si Dr. Charlie as an ENT, laging nasa hospital, very busy. Doc, gaano na ba karaming COVID patients ang dumaan sa mga kamay mo?
Yung siguradong may COVID o yung hindi mo alam na may COVID? mahirap mabilang yan.
Pareho, Doctor. Ako isama yung mga triathlete na kakilala mo. Maraming na. So, Doctor, yung ating first question. Sabi ni, she's actually a pediatrician. Sabi ni Doktora Nang, will frequent mouthwashing prevent the development of tonsillitis? Tonsillitis.
It depends.
Sorry, Doctor.
Yes.
It's actually tonsillolitis.
Tonsillolitis, no.
No, tonsillolitis.
No, it will not help. Tonsillolitis develop kasi yung may, yung anatomically, the tonsil has crypts. May pag tiningnan mo, bako-bako siya. Hindi siya makinis. Meron silang mga crevices na pwedeng doon mag-form yung tonsillitis. People who have deep crevices are prone to form tonsillitis. So the problem is anatomical. Walang gamot doon.
Nothing to do with the virus and the bacteria.
No, wala.
So, Doctor, meron bang effect si mouthwash doon? Well, preventive siguro dun sa ibang.
Ito. People with tonsillitis have bad breath. It can mask the bad breath temporarily, pero that's the most it can do.
That's the most you can do.
Yes.
So
Opo.
anong pwedeng remedy, doctor, dun sa ganong scenario?
Okay, ganito. The only way to remedy that is to remove the tonsils. However, we cannot just recommend that to patients kasi there are the society has laid down guidelines. Kailan mo pwede tanggalin ng tonsils? Well, one of the criteria is sleep apnea.
Okay.
And recurrent tonsillitis is a relative indication para magtanggal ng tonsils. Tonsillitis is not in the list for a reason to remove the tonsils. However, we have patients na nire-request talaga nila na, Dok, hindi na ako lagi, pagpasok para sa clinic, nasa isang sulok na sila ayaw lumapit kasi alam nila nangangamoy sila. There are patients who are like that. Talagang it affects their self-esteem, it affects their work, nade-depress sila dahil dun sa bad breath nila. They really request na patanggal yung tonsils pag ganon. Of course, I oblige, but I explain to them that it is not an indication for tonsillectomy. Yun.
Not an indication for tonsillectomy. Okay. So temporarily, pwede siya i-mask ng mouthwash, bad breath, but hindi siya for a long period of time.
Yes.
Okay. How about tonsillitis, doctor? Follow-up question daw.
Yes. Meron kasing cases na recurrent na yung tonsillitis.
Yeah.
Kahit pa mag-mouthwash ka, kahit pa mag-antibiotic ka, actually, hindi na talaga, pabalik-balik na talaga yung tonsillitis. Yes, that's why we also recommend tonsillectomy kapag recurrent na yung tonsillitis. So, what is recurrent tonsillitis? When you have 3 or more episodes in 1 year, you are considered to have recurrent tonsillitis, and we will recommend tonsillectomy for the patient.
3 or more in 1 year.
Yes, documented tonsillitis.
Doctor, tanungin ko na rin as a follow-up. Doon sa isang study na ginawa ng mouth rinse, apparently, hindi siya therapeutic mouth rinse to. Apparently, yung mga pediatric cases na nagto-tonsillitis, ang isang culprit o ang isang dahilan na tinitignan nila is due to poor oral hygiene. Yung bata ba at the age of 5 years old and down na palagi yung puro bulok yung ngipin, puro are actually ang isang sinabi ng study are actually very prone to tonsillitis. Tama po ba 'yon, doctor?
Yes po. Yang we have to clarify rin kasi saan ba nagagaling yung tonsillitis?
Okay.
Kasi maraming cases na hindi naman odontogenic yung dahilan kung bakit So generally speaking, I cannot say that mouthwashes can prevent tonsillitis. Pero in that scenario, of course, syempre iti-tailor natin sa patient. Hindi naman yan one size fits all. Kung identified mo na source of tonsillitis secondary to odontogenic infection, yes, then you manage the oral cavity.
Then you manage the oral cavity.
Yes, of course.
And it's the time to see your dentist. Unless it's urgent, of course, not at this time. Unless it's urgent. Meron talaga tayong sinasabi na dapat urgent yung need mo to see your dentist. But if it's not, if it's manageable, then pwede natin ihintayin yung tamang panahon. From Arnie Bona, hi Doc Charles, ano po ang causes ng bad breath?
Okay, medyo marami yan. Well, let's start with the oral cavity. Dental caries can cause bad breath, poor hygiene, accumulation sa mapagitan ng ngipin. Pero aside from the oral cavity, what else can cause bad breath? One is acid reflux. Naamoy mo yung pagdighay mo, yung ganun yung amoy, that's a cause of bad breath. And more commonly, sinusitis. Naamoy mo yung bulok na sipon dun sa sinuses mo. It can also cause bad breath. So yun are the most common causes. So tonsillitis can also cause bad breath. Yes.
So maliban po ba sa 3 times daily na mag-toothbrush at paggamit ng mouthwash? So, I think nabanggit niyo nasagot niyo yun, doctor. Ang sabi niyo nga, depende kung anong reason for the bad breath. Kung kung it has something to do with your gastro o yung sinasabi na dun sa loob, you have to really see and consult sino po ba ang pupuntahan, doctor?
Well, minsan ENT, we can manage it, or sa gastro, sa
Sa
internist.
gastro. Oo.
Yes.
So, ibig sabihin, Doc, kung ginawa na lahat ng dentista yung oral prophylaxis niya, na-restore niya lahat ng mga natanggal niya lahat ng dental caries, lahat ng cavities na-restore, kung merong dentures na ayos, and then kung may crowns na palitan, and yet meron pa ring bad breath, I think you should really need to see a medical doctor for that. Kung yon. So, meron po tayong pahabol. This is our last question from our viewers. From Dr. Speedy Bagal. Ang sabi po niya,
Okay.
Dr. Charlie, I have allergic rhinitis not relieved by antihistamines. Other oral meds and nasal spray at all COVID pandemic has somehow helped me because I wear mask outside all the time. However, I still experience clogged nose while at home. Ang question niya, I'm using, and he's also using a purifier already. Ang question niya, what's your opinion about air purifier? Do I need any surgical treatment?
Okay. Brother. So, the problem is intractable na yung allergic rhinitis. So, to answer your question, do you need surgery? No, there is no surgical procedure that will help with allergy. Allergy is an immunologic problem. Sensitive ka. That is genetic, nasa lahi yan. Just like asthma. Okay? Will air purifiers help? Yes, of course, it will remove the impurities. Pero make sure na yung yung nakaka-irritate sa'yo, wala rin sa kwarto. It's pointless na may air purifier ka, pero may alaga kang pusa or aso na kasama mo pagtulog, susumpungin ka pa rin. So, alam naman natin na ang laging nating dictum is to treat the underlying cause. Identify kung ano sa environment na nakaka-irritate. Kung nakaka-improve pag nakamask, kasi syempre, lagi tayong pinag-mask, nag-i-improve. Well, ibig sabihin, nalalanghap mo yung irritant. Hindi nabanggit sa management ay nasal steroids. It is the mainstay of management sa allergic rhinitis. I think you should consider using a nasal steroid as maintenance para ma-manage yung symptoms ng allergic rhinitis. So, to answer, will air purifiers help? Yes. Pero make sure na hindi yung sinasala ng purifier mo, meron namang nagbibigay uli ng panibagong irritant.
Mm-hmm.
Should manage the environment. Yun.
Tanggalin lahat ang dahilan.
Yes. Kung may carpet, kurtina, yung filter ng aircon, yun. Yung electric fan, punda, anti-allergic, mga ganun bagay.
Pets.
Pet, yes. Yes. Pusa, aso.
Mukhang may pet yan si Dr. Speedy.
Yan.
Patanggalin yung pet.
Baka.
Thank you, Dr. Charlie. I'm sure na-address niyo yung concern ni Dr. Speedy Bagal. And thank you, Dr. Speedy Bagal, for watching. He was the one actually who shared the video, Dr. Charlie, to us.
Thank you.
Oo. So, sabi niya, he's hoping that it could actually help us dun sa ating
yes, it did. Thank you.
Dr. Charlie, sabi niya po, ano po ba, galing kay Jessime David, paano po ba yung anak ko na laging nagtinotonsil? Tapos, bulok din po yung ngipin niya. 5 years old na po siya. Ano po ba talagang dapat gawin, Doc?
Okay, first of all, since magkasabay yung laging nagkaka-tonsil infection, poor rin yung oral condition, yung oral health, in this case, pwede tayo mag-consider na baka naman dahil sa poor oral hygiene, yung tonsillitis, ayusin muna yung problem sa ngipin. Kapag may infection sa tonsils, mag-antibiotics tayo. Kapag okay na yung sa ngipin, tapos patuloy pa rin nagkakaroon ng tonsillitis, then ima-manage natin yan. So kung mag-fall under recurrent siya, I would recommend a tonsillectomy. Kung hindi pa siya recurrent, tuwing may episode na lang, mag-treat na lang with antibiotics. Ganun na lang.
May episode, Doc. So,
Yes.
antibiotics. So, I think, Doc, yung kanina na sinabi mo, preventive is always better than cure. So,
Yes.
kung dun sa mga nakikinig sa atin ng mga mommies, iwasan nyo talaga po yung pagpapakain ng mga matatamis sa mga anak nyo. At humabol pa po ang isang tanong. Oo, Doctor, do you recommend portable cherry air purifier? Portable?
General ano yung chlorine dioxide. It's a I think it's a necklace with that emits chlorine dioxide.
Yeah, do you recommend daw po?
No.
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 So, walang effect. Oo. I believe si Dr. Charlie is less is more. Back to basic. Tama po ba, Dr. Charlie?
Yes. Kung anong
Kahit
necessary, yun na lang.
yun lang. Kahit sa triathlon, hindi siya gumagamit ng salt stick. Tama po ba, Doc?
Tama. Hindi rin ako nagte-training.
Yeah.
Minimum to finish.
Mm-mm. Sabi nung boss ko, kasama ka daw sa extreme triathlon.
Sige, game ako dyan, ma'am.
Game ka. So ano, Doctor, ang pwede mo? Dahil natapos na yung oras natin to entertain questions from our viewers, ano po ba talaga yung mapapayong nyo dun sa importansya ng complete oral hygiene as a habit, no, Doctor? Kasi sinasabi nyo nga kanina na lahat talaga, it is the easiest gateway to any disease inside the body. So ano talaga, Doctor, to simplified na lang, ano talaga yung pwede nyong iwan na paalala sa ating mga nakikinig as far as having a complete and good hygiene as a habit?
Okay. To summarize, it is important to have a complete hygiene, not just your body, pati yung oral cavity mo, kasi pwede yan makaapekto sa ibang parte ng katawan mo. Pwedeng grabe yung maging complications niya, like sa heart, pwedeng sa lungs. So, actually, doon pa lang sa ngipin, pag sira-sira yan, malaking problema rin yan. No, as a dentist, di ba? Nakakarating pa sa amin.
Doc, sorry, Doc, may pahabol lang. Yung
sure.
mga athletes daw, pagkatapos mag-triathlon, masyado ng dry yung mouth. Ano daw masasabi mo doon?
Birang iniinom nila, nakikita ko. Then, mag-hydrate lang. Just hydrate afterwards. Yes. Ayun. So, oral hygiene should be a part of our daily lives.
Yeah.
While we are pandemic or no pandemic, we should observe proper oral hygiene. Brush your teeth, floss, rinse. Prevention is always better than
cure.
Yes, spending for prevention is much cheaper than going to your dentist and less painful than going to your dentist.
Okay? Less painful than going to your dentist.
Yes.
Dr. Charlie, marami pong salamat and thank you so much for your graciousness, for spending time with us. And I'm sure naliwanagan lahat, no? Like coming from an ENT, gaano po ba talaga kaimportante yung pag-alaga ng ating bibig, lalo na ngayon sa panahon ng pandemic. So, thank you, Dr. Charlie. Si Ma'am Jackie, Miss Jackie, thank you rin for your time. Pasukan na ang Fatima this coming September.
Yes po. Thank you din po. Thank you, Doc, for answering all my questions. Ang dami ata.
No. It's okay lang. Thank you.
So, Doktor, invitein mo lang po sila. Saan po ba nila kayo pwedeng puntahan? At saan po ba nila kayo pwedeng makontak?
Okay. Sa panahon ngayon, mas maganda ang online consultation kung ma-manage. I have a Facebook page, Charles F. Dalmasio. You can message me there. If you want a face-to-face consult, I hold clinics at Health Serve Los Baños, CP Reyes Hospital in Tanawan, and the Medical City South Luzon in Santa Rosa.
And you also have an FB page, right, Doctor?
Yes po, yun po, yung Charles F. Dalmasio.
Charles F. Dalmasio. And pag sa triathlon naman, sa UP Los Baños?
Wala, bawal ngayon. Walang tumatakbo ngayon. Huhulihin ka. Wala na.
Sige. Keep safe, Dr. Charlie. Maraming
Thank you.
And Jackie, of course, maraming salamat po sa lahat sa ating resource person, Dr. Anthony Charlie Dalmasio. Salamat po sa inyong time. Salamat, Ma'am Jackie. Miss Jackie, we'll see you soon as your practicing doctor. Hopefully in 2 years. And next week po, ang topic po na ating pag-uusapan ay tungkol naman sa madalas nating mararanasan na sipon, ubo, pero ano po ba talaga yung difference ng common cold sa flu at paano po ba natin malalaman ang sakit na ito na kung colds ba siya o flu. Mag-iimbita po tayo ulit ng isang doktor na magaling dito sa subject matter na ito na sasagot sa inyong mga katanungan. It's going to be another timely and interesting topic for our viewers. Just visit and like our Facebook pages, Cell Life and Oranim, Settle and Settle Active, IC and No Rush, Neem Clean Alcohol and Hand Sanitizers at PJC Soaps. Sa mga interested po na mga sa ating produkto, you can visit us at our website www.farmaciajimenez.com. You can also get or purchase our products sa ating mga leading drugstores, Southstar Drug, Mercury Drugstore, Generica Drugstore, the Generics Pharmacy at sa mga authorized provincial distributors nationwide. We will see you again next Saturday via FB Live and via YouTube Live for another episode of Nutrition and Health Webinar Series. Magandang hapon po sa inyong lahat. God bless.